to introduce our Saturday morning keynote speaker, Mr. Ted Alemayhu. He's the founder and chairman of U.S. Doctors for Africa, also known as USDFA, a nonprofit organization dedicated to mobilizing volunteer doctors, nurses, and other healthcare professionals to fulfill the overwhelming medical manpower needs throughout the African continent. As an internationally respected humanitarian leader, Alemayhu envisions a future for Africa in which it produces and invests the economic wealth, intellectual capital, and human resources required to provide medical care to its entire people. What you need to know about the one we affectionately call Ted is that he has the Midas touch, meaning that he is really able to enlist all sorts of people across this nation and around the world to support his efforts. He has been recognized by African heads of state, members of the U.S. Congress, U.S. senators, the World Bank, the International Monetary Fund, Secretary General Kofi Annan, President Clinton, NASDAQ, as well as numerous heads of corporations and foundations. And so I ask you to read his entire bio sketch in the program. But without further ado, and allow him to truly enlighten us and inspire us and motivate us to come on board and to join the movement to bring quality health care to the continent of Africa. Let us warmly welcome Ted.
Thank you so very much, Dr. Wallace, for the warm and generous introduction. First and foremost, I think before I start my presentation, which will be more of, I think, a conversation style than a written speech or anything of that sort. Before I do so, and I think it's fair and appropriate to recognize Dr. Barbara Wallace and her team for dedicating her time, I'm sure it's a lot of sleepless nights, to organize this 2 days conference. And I apologize that I missed it, but a round of applause and congratulations. I am incredibly grateful by this honor to be invited by Dr. Wallace and this institution that's known around the world to be most recognized and respected institutions. Having said that, before I do my formal presentation, I do have approximately 4 minutes video that I'd like to share with you. It's a rather long PSA, but it kind of shares the vision and mission of U.S. Doctors for Africa, who's supporting us, who's involved, and that sort. So take a look at it, and I'll come back and I'll tell you the whole story behind this movement that I was blessed enough to create. Take it away.
The great Albert Schweitzer once said, "Therefore search and see if there is not some place where you may invest your humanity." 2/3 of all known cases of HIV/AIDS on planet Earth exist in Sub-Saharan Africa. An estimated 29.5 million human beings currently infected, about the same number as the combined populations of the states of New York and Michigan. In Zimbabwe and Botswana, 1 in 4 adults carries the virus. A child born today in Zambia or Zimbabwe is more likely than not to die of AIDS. HIV/AIDS has eclipsed malaria as the #1 killer on the African continent. The African HIV/AIDS pandemic as well as the alarming reemergence of malaria and tuberculosis, are insidious demons that stalk and threaten the very future of mankind. U.S. Doctors for Africa is an organization devoted to not only providing direct intervention and assistance where it is most needed, but also to demystify the dynamic of communicable disease, both on the African continent and for all the world. This is accomplished through establishing new lines of communication between governments, partner non-governmental organizations, or NGOs, and medical institutions, augmented by a state-of-the-art disease tracking and treatment database that will transcend physical borders and bureaucracy and unify the efforts to eradicate HIV/AIDS and other communicable disease through education, technology, and prevention.
Mission and vision of U.S. Doctors for Africa. And I hope that video gave you an idea as to what this organization is all about.
Can we get the light back on?
Great, thank you. I hope it gave you an idea as far as what the organization is all about and ultimately what our goals would be in the long term. But I think let me just take a couple of steps back and recognize the two speakers before me, in particular, the gentleman, the doctor, who's sitting here, and I know the other gentleman went, yes. You know, sir, I learned a lot from a domestic standpoint, what the needs are from a healthcare standpoint. And I'm thinking while you were speaking, I was thinking, think of the African continent potentially a million times worse than what we're facing here. The purpose behind mobilizing medical manpower in creating such a movement or an organization called U.S. Doctors for Africa is to precisely to bring in the medical teams that are desperately needed in order to provide direct medical care for those who don't have access to. Currently, you heard from Kevin Walsh speaking about 12 million orphans in Africa, as well as over 27 or so million people affected by one disease, and one disease alone, that's an HIV/AIDS. We're not talking about malaria, we're not talking about TB, we're not talking about any other communicable diseases, very preventable yet extremely devastating for the continent because Africa does not have the type of manpower that needs in order to overcome the challenges that it's faced. The story behind forming the organization, I think, is to be more exciting to you to hear. Because I'm not here to tell you the statistics, how many people are dying every day in Africa. That's a known fact. You've heard it enough again and again, from the newspapers to the media to Hollywood celebrities and everybody that speaks on behalf of Africa, I think have communicated enough about the desperate need for medical manpower and the resources that the continent is currently facing. So I'll be preaching the choir if I go back and remind you what that is. So I'm not going to waste your time on that. Most importantly, I think what we should talk about is, what is the solution? We have heard enough of the problems, right? 27 million people affected by one disease. 2.5 million people died last year. You have a very basic, in my opinion, I'm not a doctor, but a very basic disease called diarrhea is killing millions of children throughout the African continent. For I think people who are not aware of the situation will sit back and say, you gotta be kidding me, right? We had a mission that, it's not a part of U.S. Doctors, but a different organization sent a mission to Africa and learn about this particular disease and the fact that millions of kids are dying from this very, very basic preventable disease. And they came back and said, look, we gotta do something about it. In situations such as the diarrhea, I mean, we're talking about HIV and AIDS is such a complicated disease and such a complicated target that a lot of resources have been allocated toward Africa to fight AIDS, to create an awareness. Speaking of HIV and AIDS, all these years that we've been told, the statistics, the messengers are very effective, the drug companies are getting involved, right? Foundations are pouring billions of dollars to the continent. And there is some progress is being made, but in my opinion, as far as coming up with the concept of U.S. doctors for Africa, there was one missing gap on this very complicated puzzle that everybody tried to solve in the continent. There was one chunk piece that was missing. That missing piece is the medical professionals. You know, we can pour in all the ACE drugs, all the billions of dollars, and everything else to help the continent, but unless we have the proper medical personnel to fulfill or to deliver these drugs to those who need it most, it's job halfway done, in my opinion. So that's where, over almost 8-9 years ago, when I sort of was in soul search of my purpose, what I wanted to do in my life. I was an accountant working in corporate America in Los Angeles, California. But I knew from day one that it was not the purpose of my mission in life. There was something better, it was something that needed more value, has more value to help the people that I left behind. And I left Africa and Ethiopia at the age of 13 and a half. So having said that, and reading more about the continent, reading enough about the people who are dying every day, 6,000 children will die before the end of this day. That's what the statistics say. Every 6 seconds, a child is born HIV positive. And then you hear that there are one doctor per 100,000 people in most countries in Africa. So, I mean, you just do the math as far as what the primary needs or the crucial approach of mobilizing doctors to go over to Africa and provide this life-saving care, right? So I looked at it from a business standpoint and supply and demand issue. You got one doctor per 100,000 people. In America, as Kevin said on the video, a country that has tremendous resources, and most importantly, people are willing and ready, as long as the message, they have the message, effective communication, and the project and the purpose that inspire them. They're willing to go 20,000 miles from here, in some cases more, to meet people they've never met in their life before, to go to a continent they've never been before, to save lives, to deliver this crucial medical cares. So I took on that opportunity. And the turning point of this mobilizing this organization was, after reading the New York Times and other articles, the shortage of medical professionals in Africa, and I think of myself, I said, wait a minute, let me just do a little bit of digging and see how many doctors are in America. It's just licensed medical professionals practicing. Google the number of, read a bunch of books. And over 850,000 physicians is one statistics told me. I said, that's brilliant. 850,000 doctors, wow. So that's great, because all I have to do is form this organization. I didn't know what to call it back then, right? Mobilize 50 or 100 out of 850,000. I think I should be able to organize that team, right? So committed my time, read about Doctors Without Borders, the Red Cross, and other charities as far as what they're with the background, because the last thing that you want to do is form an organization that other organization is exactly what they're doing, so duplicative efforts. So reading about other organizations, their mission and vision, and work that they do, that made me a clear target or clear opportunity to form this organization, because Doctors Without Borders and similar organizations are by most known as relief agencies. In other words, they react to disasters, flood, starvation, refugee, war, and what have you. And they're doing a fantastic work all over the world. Africa, looking at the continent of Africa, the dire need for medical manpower. We're not talking about the most sophisticated medical care in most cases. We're not talking about this super high-tech expertise to go in and create a number of things. We're talking about a team going in and delivering basic medical care. That is what is missing. Because of that, millions of people are currently dying. So what I did was, after I found my passion, I found this concept, and I have a purpose, and I have a reason to form this organization. I called it U.S. Doctors for Africa. The mission was very simple. The mission is to mobilize U.S. doctors and nurses and other healthcare professionals who are willing to give their time, short-term and long-term, to go over to Africa and provide healthcare that's what they're trained for, healthcare based on or specifically on their expertise. If they are HIV experts, fantastic. If they are nurses, fantastic. And as long as they have the proper training license or a medical certificate that they are indeed doctors, they're welcome to this umbrella that we created called U.S. Doctors for Africa. Now, from the recipient side, we have NGOs, government entities, foundations are looking for volunteer doctors and nurses and other healthcare professionals to come and help them materialize their goals. In this case, whether it's primary care or teaching the local medical health providers, or training or mentoring, whatever that may be, they can come to this umbrella. It's called U.S. Doctors for Africa, and we can help them channel these resources to where they're needed most. So, going back to the story, I'm going to be going back and forth, so make sure that you don't get lost. Forming this organization, then I started thinking, I said, wait a minute, so this thing is organized, officially formed, I didn't have board members, I didn't have a set budget to get the word out. And I said, okay, what to do next? So I had a separate line in my house, in my bedroom, which was the headquarters of U.S. Doctors for Africa, with answering machine. And there was maybe 2 or 3 pages of website talks about mission, vision, my picture, and basic information. Then I had a Honda Civic back then, and because I didn't have a budget, then I said, wait a minute, I gotta be a little bit creative. So went to the local signage store where they make signs and logos and what have you. I asked them to design the website address, www.usdoctorsforafrica.org. That was brilliant. Sunday morning, on my lunch break, after work, with no reason at all, I start driving around downtown Los Angeles, Beverly Hills, California, Bel Air, where I felt that these doctors are around so they can take a look at this logo. Right? And you know, it's, of course, I have my little radios on, so I'm driving around. And sometimes I get this really exciting, they blow their horn on the freeway and say, great website. I say, thanks. So run around. Then what happened was, the purpose behind this was to get the word out. Right? And so it just happened that one day, I had an NPR reporter driving right behind me on the freeway. So she saw this long URL, and she got closer and closer and read it. She said, wow. She went back to her office, checked it out. I'm not sure if she spent enough time on the website. I had no idea. But next thing you know, it was a phone call from her office to the headquarters of U.S. Doctors for Africa. In this case, it was my bedroom. Right? And so after work, I come home, play the little machine, and says, oh, hi, I'm so-and-so, I'm with NPR News, that we want to do a story on your foundation. I said, oh my goodness, this is brilliant. I mean, NPR News, I listen to NPR all the time, and I was going absolutely nuts. So what to do? And then finally I returned a phone call and he said, look, I'm with Tyvis Smiley Show. on NPR nationwide. We want you to come with one of your volunteer doctors and talk about the mission of U.S. Doctors for Africa. It was brilliant. So the first doctor who signed up with our organization was a good friend of mine, now works with President Clinton's foundation as the head of their international training program, I believe, Eric Fleischman. So I called Eric and I said, Eric, we're going to be on NPR News. He said, I love NPR, Ted. I said, well, let's get together and explain what this mission is all about. So we went on, and it was my first radio interview. I was nervous, I was terrified, I didn't even know what to say, and type of smiley. And so anyways, to make a long story short, Dr. Fleischman rescued the interview. He talked about what this vision was. Keep in mind, nationwide, people are hearing this. Next thing you know, 24 hours later, we have hundreds of calls. People say signing up on the website, calling, my voicemail is full. Every day I come, the answer machine is full. We're talking about medical students, people who are in training, the residency program, retired nurses and doctors that wanted to join, African diaspora, African physicians that work and live in America. I knew I had something important that requires my full attention and continued dedication for this cause. So we organized a fundraiser. We had missions to South Africa, Ethiopia, and Kenya, assessment mission to create partnerships with the local NGOs, creating a relationship, an introductory with the Minister of Health of these countries. And I wrote a letter to members of Congress, and basically African ambassadors back then, to introduce the U.S. Doctors for Africa organization, not asking for funding or anything else, just say know us, that we exist. And when we're prepared that we need your help, we'll be reaching out to you. But just keep that in the back of your mind. Boy, the response, the endorsement, the excitement, the energy behind this cause was beyond my imagination. It was incredible. So fast forward, we created a partnership and we started deploying physicians to clinics and hospitals with the minimum funds that we raised with fundraising events and direct contributions of friends who owns companies and what have you. So the first 4 years of this organization, which we've been around almost, like I said, 8+ years now, was to build the foundation, build it well, build the medical manpower who are willing to volunteer their time and expertise. Then I'll have an excuse to go to Congress, to Bill Gates, to anybody else, and say, I have this many physicians willing and ready to go, and to help the continent of Africa. And we know the funding is there. We know for a fact that Africa needs physicians and other healthcare providers to fulfill the gap, to train the local doctors and nurses, and to mentor the midwives, and a number of initiatives that's being discussed with WHO or UNICEF or the President's Emergency Fund and what have you. So we knew that we had something special and very crucial. So we did that, and everybody's now aware of this organization. I have hundreds of people signed up. I don't know what to do with it because there's a lot of people who are signed up. I need a lot of money to get them where they need to go. But the number continued to build. We kept in touch with most of our volunteers, letting them know that we're in the process of raising funds, and when time comes, they will be approached for deployment. Then we did a number of missions to Ethiopia and South Africa and a few other countries, which is on the website. You can take a look at it. And then because the number of volunteers grew, we decided to create a membership opportunity. There's no due, but doctors and nurses can sign up as members of U.S. Doctors for Africa. And again, the purpose is to have that core team, dedicated team, that could be called upon when the time comes and the project exists. So what happens after the word went out and a lot of people heard about us? One day, I still remember that day, I'm sitting in my office, but this time we have actual office, by the way. We do. We do have a nice office, which was, by the way, is donated by a gentleman. We actually have a nice big office in Los Angeles, donated by a gentleman who heard about U.S. Doctors for Africa, invited me to lunch. And he said, Ted, I heard this whole thing that you're trying to do. And I know, because your office is your bedroom. So if you ever need office space, let me know. I said, absolutely. Immediately we need one. So almost literally 24 hours later, he gave me the key to an office in a very expensive area in Los Angeles. All these years now that we have that our headquarters, which the organization is now paying for, which is very exciting. And so that's what people got inspired to understand the vision of this organization and what it can fulfill in short term and long term. Now going back to the phone call that I received from President Clinton's office, which is the turning point, the most exciting part of this. Never thought in my wildest dream that someone from President Clinton's office will call me to talk about a possible partnership with U.S. Doctors for Africa. Although I knew we had a great organization, but we were not prepared to face, this big partnerships and what have you. So the phone call came in, and there was a chief of staff for CHI, which is Clinton HIV/AIDS Initiative, and said, look, we want to talk about as far as strategic partnership between U.S. Doctors for Africa and the Clinton Global Initiative HIV/AIDS program. And I was thrilled. Said that this is fantastic, absolutely. Right? Because we know what we're going to provide, which is our medical manpower. And of course, President Clinton has worked tirelessly and continue to do so to fight AIDS and other communicable diseases throughout the country, throughout the continent. Lots of resources are being deployed. It was a privilege and honor to actually be asked to partner with their initiative. So we did so, and our first deployment was in Tanzania. And then the word went out to different foundations. So the phone calls came. And I get to be invited to a number of meetings and what have you, which is also very exciting. So with more notoriety and with more resources, there are more responsibilities. And so that responsibilities become, as a leader of this organization, what sort of new and attractive and doable initiative can we introduce to the public? And so therefore, the public will believe that we do in fact have a powerful message and a powerful project that they can back us up. Last year, and again, most of the information should be on the website, and there's a lot more it's not, so you're more than welcome to take a look. Last year, I was invited to participate with the Clinton Global Initiative, which is another powerful meetings that President Clinton is able to organize. Leaders from around the world come to discuss very pressing issues that's facing global, either it's the environment or healthcare or what have you. In that day, we were asked to make a commitment, the organization, as far as what would be the next approach of U.S. Doctors for Africa. What do we envision, whether or not what we're proposing is in fact something we're capable of fulfilling. So we talked about a number of things with my team, what that commitment would be. And we realized that currently we have several thousand volunteer medical professionals signed up with U.S. Doctors for Africa, which is a great accomplishment thus far. We've had a number of missions based on the funding resources that we've had. Now, I think it would be perfect if we introduce something that would go along with the medical manpower that we have. So I said to my team, look, and it's great to have all this, but the next commitment should be to deploy mobile clinics throughout Africa. It made a lot of sense because now we have enough medical manpower joined by the mobile clinic, and we know that approximately 85% of African population live outside of big cities and towns. In other words, they live in rural Africa. Those are the people who are most affected by these diseases, most of the people who are dying from preventable disease are those who live in rural Africa. And so this concept or this commitment of launching mobile clinics made a lot of sense. So that the idea is to bring healthcare to where these people live, because they don't have access to come to big cities and towns to receive the proper medical care. That commitment was something that a lot of folks that praised and endorsed. And of course, this is a 15 to 20 years commitment of deploying 200 mobile clinics to Sub-Saharan Africa. And I'm happy to say that we're ahead of schedule. In fact, our first mobile clinic is on its way to Africa now. Last week, yes. So the whole goal is, keep in mind, and I'm sure you understand that big picture of having these mobile clinics, driving around these small towns and giving vaccinations, giving the proper care to a woman who's ready to give birth, but she doesn't have access to transportation. And therefore, this clinic will be there to provide that very life-saving treatment and care. I know I have, I think, 2 more minutes left. Am I right? Okay. So, 5. Super. So, having said that, now we have engaged in deploying mobile clinics with our medical manpower tool. And I do need to remind you that, and again, having no expertise in any healthcare profession, my vision was, I've heard enough very powerful message from various areas, very powerful statistics from experts like the previous speakers here, head of states, movie stars, head of religion groups, Christian, Muslim, Jew, and what have you. The problem is powerful enough to bring all these people together. And the fact that Africa has always been the worst victim of this preventable disease that's wiping out of the society. And I think playing a small but effective role, such as mobilizing a team, they can go over, save lives, come back home. I don't care how long they stay there, 2 months, 6 months, a year. I think and they came back saving 2 lives or 100 lives. In my opinion, the mission is accomplished. Right. So that has been the purpose. I'm grateful to say that now we have a lot of volunteers. The organization continues to grow. More funding sources coming our way. Lots of Hollywood celebrities, if you flip through this, or indeed, in fact, the PowerPoint, if you go toward the end, you will see the endorsement that we've had from a number of Hollywood folks. And the mission goes on. Now, domestically, for 30 seconds, domestically, what have we achieved? We all remember 4 years ago, Hurricane Francis that literally destroyed Florida and the Bahamas. 2 years ago, we had Hurricane Katrina and Rita. I don't need to preach the choir again. You know what happened. So we tapped into our resources and deployed our volunteer physicians to New Orleans, and the governor was kind enough to recognize us for our service, and to the Bahamas 4 years ago, Hurricane Francis. We were one of the few U.S. organizations to mobilize nationwide to organize baby food, diaper, and food, and shelter, tents, and what have you. I had a gentleman from New York City, a very well-off gentleman with a private jet, offered his jet to take our doctors from wherever they are to the Bahamas and do the service and fly them back again. And that happened. And of course, we are not necessarily communicating effectively, but talk about the organization's commitment and the passion that we have toward saving lives. And again, to wrap this up, it is a lot of the information you can find on the website. I will be more than happy to answer any questions that you may have. But it's a privilege to be to be able to fulfill my vision. And a great blessing to have thousands of people across this nation, around the world, following this vision and to help us grow and to fulfill our ultimate goal, which is to train more medical professionals, to save lives, to mobilize and create a unique relationship between these two nations, the United States of America and the continent of Africa, that in fact they need each other for a number of perspectives. So having said that, thank you for your time, and I am truly honored to come and present, to introduce the organization. If you have any question, I'll be more than happy to take, and if not, I'll be here all day, so I'll be available. Thanks.
Let me get on this side. Yes, standing ovation is certainly in order. As you discovered in listening to Ted, one of his favorite words is brilliant. But if there's anything or anyone who's brilliant, it's Ted and his vision. It's an absolutely brilliant vision. So let's thank him again. In addition, you can see that it's about one fortuitous event or connection after another. And so we're hoping that what happens today at our gala fundraising dinner is that we come together and are able to contribute something to honor Ted. Now, of course, now I'm very embarrassed because my favorite plaque company in California did not deliver the plaque yesterday, and they're closed on Saturday. It's a family business. But because we have this nice photographer here, I had one of my students go get what we're going to use as a prop. Use what you have, not what you want, prefer to have, kind of the African way. Use what you have. So we're going to angle this plaque so that you can't read the words, but you see that I'm giving him a plaque. So we'll hope that the light will blind it, okay? So let's see how good you are.
We have one more surprise for Ted. He hasn't seen this.
Oh, well, that's better than his prop then. Okay, so let me read what the third annual Health Disparities Conference is giving to Ted. The Harriet Tubman, okay, let me start over. As the director of the third annual Health Disparities Conference, I am delighted to present the Harriet Tubman Freedom Award for outstanding global community activism and lifetime achievement to improve health, honoring Ted M. Alemayhu, founder and chairman of the U.S. Doctors for Africa, for being the kind of visionary leader who inspires and mobilizes others to action within a global movement and mission to bring quality health care to Africans in Africa. March 8th, 2008, third annual Health Disparities Conference, Teachers College, Columbia University. Now let's see how we can angle this. This other award too? Okay, this is a lot of fun.
That's fantastic. That's fantastic.
This is a photograph of the U.S. Doctors for Africa Mobile Clinic number 1, February 27th, 2008. A photograph. He's going to love this.
Oh my God. This is brilliant.
Okay, wonderful. Now, we should probably ask Dr. Judy Karansky to come up here now. But you're gonna stay just for a moment, Ted, because when I didn't have the correct plaque, and now, please, Tonya, could you put this back in the box? Take it back to my office. We'll get a FedEx address for Ted too. So some of you know Dr. Judy Karansky. She's acclaimed sex therapist, clinical psychologist, professor in our Department of Clinical and Counseling Psychology here, and someone who was just so present and so full of love that it just blows us away. So I also asked her, I was lamenting, oh, we don't have a plaque. So Dr. Judy said, well, just give him some of these. So therefore, Nana Karantama autographed her 2 books, Tigray Speaks, and one about her mentor and the tradition from which she comes, and then the CD, because her performance yesterday was great. So she's autographed all 3 of these. So because of Dr. Judy, you get more than just a plaque for your wall. And then you get my new book, which is Toward Equity and Health, a New Global Approach to Health Disparities, and then the HIV/AIDS for Education Training Manual, all autographed with, and just, you know, burgeoning with our love and respect for you. Thank you so much. Hey, we need someone to help him. He's got all this stuff.
I do, actually.
Okay.
Let's put this. And I know my time has expired, so I must apologize. Look, I am stunned by this surprise. Bennett, you're the man. He's incredible because this is what the movement is all about, is to deploy this mobile clinics that you're looking at. And Bennett came to Washington, and I had a brief press conference for the local TV and those who support us to actually showcase this mobile clinic before it's on its way to Maryland Airport in Baltimore. So this means a lot. Dr. Barbara Wallace, and once again, thank you. Simply, and it's not so much that I can say, but I always say I wish English was my first language because I can think of some powerful words.
Go ahead, say it.
But yeah, but I'm truly, truly grateful.
Okay.
And I do thank you so very much. And of course, my colleague, Dr. Judy, is simply incredible for taking her time to join U.S. doctors to spread the word in the New York area. And I think as we grow, she will be an instrumental player in this movement. So thank you again.
And you'll get this in the mail.
Great.
As Ted said, this is fantastic. Great honors to you, Barbara, and for us all making the commitment yesterday that you made us give, that we can repeat again, that Barbara said, I'm calling for a 21st century global civil rights movement for equity in health for all. That was brilliant, fantastic, as Ted would say, and very inspiring. I couldn't get it out of my mind all day yesterday and all night last night and all day today. And that is indeed what we are calling for. And all Barbara's words yesterday morning fit so perfectly into the mission for U.S. docs. Every concept, the civil rights aspect of it, the opportunity for equity in health, the serving those who need it, and the global initiative. So I get goosebumps thinking about that. In fact, if we all, in our bedroom, had things happening like what Ted created, it would be an astounding new world. Yes, right. You heard Ted describe the medical services that U.S. Doc has been providing and the exciting deployment of the mobile clinic just last week to Ethiopia from Washington, D.C. Another initiative that U.S. Docs has undertaken at Ted's Brilliance is the psychosocial arm of this project that has been focusing on medical services. Barbara's conference here stressed, and Barbara talked about yesterday, the services for physical health, for mental health, and for spiritual health. And so the new initiative for the U.S. Docs is to include those other multidisciplinary and multidimensional aspects into the project. So we invite you to join the psychosocial arm of U.S. Docs for Africa. And Dr. Wallace has been so gracious and so generous to offer us the opportunity to have the regional meetings here in New York and here at this conference to include those other dimensions, the psychosocial arm, and to facilitate and build the team here, starting here and then growing for US Docs on these multidimensional levels. So please join us for those meetings. It's in your program, starting at 2:15 in Millbank Chapel, which is actually in the main building, a gorgeous chapel. It is the most inspirational place, truly, to start this initiative. So I look forward to seeing you there at 2:15 at Millbank Chapel for the team building for US Docs. This is an outgrowth of the initiative that we had just recently in February, where an assessment team went down to New Orleans. Ted talked a lot about the amazing work that US Docs is doing to serve the continent of Africa, so direly needed. We all know how needed similar services are right here and right down south in New Orleans and in those affected by Katrina. What we found was that everyone we spoke to there, from the aging home to the teen services to the volunteer NGO, said that they are suffering emotionally, now years later still, from the aftermath of that devastation. And they are desperately in need of help and support from those of us who can do something to help our neighbors down south. And so we have initiated a project in the lower Ninth Ward and other needed areas that is extremely exciting to offer the mobile clinics and psychosocial services. So please join us at 2:15 in Millbank Chapel, and thank you all for being here, for your hearts and your minds. I appreciate it.
The preceding program was brought to you by Teachers College, Columbia University. Please visit us online at itunes.tc.columbia.edu.